maybe just have a hard baby. Let's talk really fussy babies. I was talking with our pediatrician about just how fussy he is. And luckily or not luckily, depending on how you look at it, he was having one of his fussy fits at the doctor's office so he could hear and see exactly what was going on. It did end in an explosive poop and a giant fart, in case you're wondering. So I started talking to the pediatrician about it, and he had mentioned some things, and the options that we talked about were trying a very, very sensitive formula for a week to see if it's my breast milk that's causing issues, visiting with a lactation consultant just so she can see if he's swallowing a lot of unnecessary air. Pediatrician at our very first appointment did say he has a little bit of a lip tie, but said that shouldn't affect latch. But I've seen differing opinions on that, so I don't know if I want to try to get that flipped. And the last thing that we really talked about was me possibly cutting out dairy or gluten in my breast milk just to see. Well, I guess that's not the last thing. What I already was trying was gas drops and the colic drops. So we're going to continue with the gas drops. I'm going to try to be really consistent with his gas drops before we try any of the other options, just because that's the most convenient thing to test. And besides that, my pediatrician was like, and you could do all of that and he could still be very fussy. You maybe just have a hard baby. It's just when he cries, he seems like he's in so much pain. So it kind of like, I feel so sad about just like waiting it out and not doing anything. Like if you've had to cut out dairy from your diet while you're breastfeeding, like what signs did you see in your baby that made you do that? Ultimately, we're just gonna keep waking up and doing our best every day because that's all we can do. But I'm all ears if anyone has been through this and has any tips